Hey guys, this is Chris Dewey with May River Medicare, and it's time to do our changes and costs of Medicare for 2024. And let's go into it. Just real brief, the things that matter to me. For those of you, the increases for 2024, you got a bigger Part B premium. Part B premium is $174.70. Last year it was $164. Your deductible last year, your Part A deductible was $1,600. This year it's going to be $1,632. Now this is if you just have the red, white, and blue Medicare card, you don't have anything else. You go into the hospital day one, you're going to pay the $1,632 hospital deductible. You could be there 30, 40, 50 days, doesn't matter. That's all you're going to pay. If you leave the hospital and go back in and you're out of the hospital for a full 60 days, that you got to pay that deductible all over again. And we're going to go into this other stuff. The Part B deductible, those of you that have Medicare supplements know it's gone up. $240 for your Part B deductible. For those of you that have, for instance, the Plan G, once you pay that $240 deductible, you have no costs as far as medical goes for the rest of the year. Now, just for blanks and giggles, let's take a look at 1974. That was 50 years ago. All right, the Part B premium back then was $6.70. All right, and if you went to the local supermarket back then, and you got a fresh roasting chicken, 49 cents a pound. And here, well, you go to the food line, you can get that same chicken for 99 cents a pound. So, but then again, you got to figure 49 cents back in 1974 with inflation, that's probably more like, $2 or $3 today. So ribs, $2.49 today. We go back to the old A&P, only 89 cents. All right. TVs, wow. I miss those old TVs. If you look, 1974, here's a General Electric for $1,650. Guys, today you can go to Best Buy and get a really nice TV for $500. So we're making out on the TVs. TV prices have gone down. Food prices have skyrocketed. The cost of healthcare has gone through the roof as well. So let's keep going. But you got to admit, those old school TVs were amazing. I wish we had the wooden ones that we used to have where you could put stuff, hide stuff in the drawers. I lose my remote control constantly. If they came up with a nice TV that had the nice wooden furniture carved and you could just pull the drawer out and leave your remote control in that drawer, I'd never lose my remote. That's an idea that they should think about for sure. But just keep in mind for this year, for 2024, good news, limits on drug costs. So in 2024, if you reach that catastrophic phase, you used to have to pay 5% of whatever the retail cost of the drugs are. 2024, zero during the catastrophic phase, all right? That's a huge positive change for people that take a lot of drugs. Also, extra help. We're going to get into that in a second. But the 2024 extra help limits, this year, if you're single and you're making right around $1,860 in that range, and you have less than $10,000 in assets, you're going to get extra help, all right? And the nice thing is for 2024, whether you get partial extra help, full extra help, 75%, 25%, 50% extra help, doesn't matter. All of you are going to get the same extra help benefits. And again, we're going to go over that in a second. All right? Just some reminders. Most of you already know they're on insulin, any type of insulin, $35 for insulin, whether it's Levemir, Novolog, Humalog. Just keep in mind that you want to make sure that your type of insulin is covered, or you might have to get a formulary exception written by your doctor. So you want to make sure your insulin is in your drug formulary, all right? Good news on vaccines. No cost for COVID vaccine. There's no cost for any type of vaccine, all right? So that's huge. Same with COVID testing. And all this information I'm getting from Medicare Interactive, guys. If you get a chance, go to that website. It's a not-for-profit organization. These guys are the best, especially for folks on low income, to give you some information that might be helpful. So back to Part A costs. That's hospital. Just real quick, for those of you who have not worked 10 years or more in your life, for those of you who have worked 10 years or more in your life, Part A is free. You paid that through your FICA taxes. If you've only worked 7.5 to 10 years, you got a Part A premium every month, $278 a month. If you work less than 7.5 years in your life, your Part A costs are going to be $505 a month. That's your premium for Part A. Best advice I could give you is marry somebody that does qualify to get Part A and Part B Medicare, because if you marry somebody that's qualified to get Part A and Part B, you will automatically get it. So best advice I can give you is marry somebody that's worked over 10 years. All right? And then as far as hospital co-insurance goes, first 60 days of inpatient care are zero. 61 through 90, I can't imagine anybody being in the hospital over 60 days. I guess it's possible. Usually you go to skilled care. But if you're there for more than 60 days, you got to pay $408 a day for 61 through 90. After that, you get 90. After day 90, it's 816. Those are your lifetime reserve days. Skilled cancer, you're not going to, skilled nursing, you're not going to pay anything for days 1 through 20. After that, it's $240 a day. All right? Don't confuse skilled nursing with long-term care or a nursing home. Two very different animals. All right? So Part B, we already kind of went over that. Your Part B premium is $174.70. People with higher incomes are going to have a higher Part B premium, and I'm going to show you that in a second. All right? Deductible, the Part B deductible is $240. Most people have either a Advantage plan or a Medicare supplement. People that have a supplement that are new to Medicare and have, let's say, a Plan G or a Plan N, you gotta pay that $240 deductible first. Once you pay that off, pretty much with the Plan G, everything is zero for medical. Plan N, you got a little doctor copay, $0 to $20. And of course, you got the biggest reason why you got to get something besides just original Medicare is you got to pay 20% of most Part B covered services. You go to get outpatient surgery, they even do stints now as an outpatient setting. You got to pay 20% of whatever that surgery costs. That's why you want a supplement or something like an Advantage plan. If that's the way you're going to go, I don't recommend it, but if you do, at least you'll have a copay of, let's say, $300 or $400 for outpatient surgery rather than 20% of who knows what. Guys, so quickly, many of you in the Hilton Head Bluffton area, retirees, you're going to pay more than $174.70 a month for your Part B premium. Why is that? 95% of all the people in the United States are going to pay the $174.70. You're retired, your income's less. If you're single and you make less than $103,000 a year in interest income, Social Security, add it all, roll it all up in one ball of wax. Some of you might have teachers' pensions, whatever, but if your income's less than $103,000, then you're good to go. You don't pay anything more than $174.70. If you file jointly and you're married and you make less than $206,000 in interest income, that includes interest income from dividends, muni bonds in your portfolio, your pension, your Social Security. And what they're going to do is they're going to look back at 2022. All right. So today, 2024, they're going to look back at your tax returns. You can appeal this. So let's just go through this first before we talk about the appeal. If you're single and you make 103 to 129 a year in income, you're going to pay $244 for Part B. You're going to pay an additional $12.90 for your Part D premium. So let's say your Part D premium is $20 a month. If you make between 103 and 129, you're single, you're going to add $12.90 to that Part D premium. You're going to be paying $244, not $174 for your Part B monthly premium. And guys, the more you make, the more you're going to pay in Part B and Part D, all right? 129 to 161, single, or 258 to 322 if you file jointly, and you're in that strata, you're going to pay $349 for your Part B monthly premium. You're going to pay $33.30. That's going to be added to whatever your Part D premium is. Let's say you had the 50-cent WellCare plan. If you make between $258 and $322 a year, and you're married, you file jointly, they're going to add $33.30 to that 50 cents, and that'll be your Part D premium. But look on the bright side. You're helping a lot of other folks that I'll show you in a second that don't have to pay the $174.70 a month premium. So you can just look. If you make this much, you're going to pay this much in Part B premium. If you make $500,000 or more single, or $753,000 and you file jointly, that's your income per year, you're going to pay $594 for your Part B premium. But you know what? If you're making that much, that's not going to hurt you too bad. You're going to add $81 to your Part D premium. Hey guys, on the flip side, those who make more pay a higher Part B premium. Those who make less are going to pay less. And what I mean by that is the most important number you have to look at. This is the 2024 Medicare Savings Program. Medicare Savings Program is a fancy word for either full Medicaid or partial Medicaid. And a lot of my clients get it's basically if you make less than $1,715 a month, your $174 Medicare Part B premium will be paid for you. Okay? And for folks in Georgia right now, you would know you got to renew. If you don't renew your Medicare Savings Program or partial Medicaid or full Medicaid, you will lose that. So this is the time of year for a lot of you folks. This time, as COVID's over with, you have to reapply each year. So 1,715 is a magic number. So that's before any deductions. 1,715 before they deduct the 175. If you make that or less, you can get the $174.70 paid for. If you're a couple and you make less than $2,320, you are in monthly income, the 174 for you guys will be paid for. All right, but just remember, they also look at your assets. You got to make less than $10,000. Your assets should be below $10,000. That's all your assets in the bank. They don't count your house and they don't count your home. Next thing, Part D costs. So the average 2024 monthly premium comes out to $32.74 a month. All right, people with high incomes have higher Part D premiums. People with lower incomes, they will not have a Part D premium or a Part D deductible if they have extra help. So the deductible for 2024 is $545 for Part D plans. Okay, guys, the last thing I'm going to dive into is the cost of Medicare Advantage. Medicare Advantage is known as Part C. Okay, Part C is Part A, hospital, Part B, everything outside the hospital, and Part D, your drugs, all bundled into one package called Medicare Part C. So all you need to know about that is you still got to pay your Part B Medicare premium. The $174.70, unless we talked earlier, you make less than $1,660 a month as an individual, and you get the $174 paid for. If you're above that, you're going to pay the $174.70 a month. People are sometimes think, I have an Advantage plan. It pays my Part B premium. No, it doesn't. Unless there are a few select give back plans that give back between $50, maybe $75, $100 tops. They'll give you that back. They don't really give it back to you. What they're going to do is pay $100 of your $174 Part B premium. If it's the $100 give back, they'll pay $100 of the ones. So they're only going to take out $74.70. If you do the give back, I would use that $100 they give you, get an indemnity plan that covers your cancer, covers your outpatient surgery, covers your hospital copays. So that way, basically, you have an Advantage plan with no huge bills. All right. Medicare Advantage plans, we're going to talk about what the deductibles and the copays are in a second. But the big thing you got to know, for 2024, the max out-of-pocket can be as much as $8,550. So when you join an Advantage plan, the first thing I think you really want to look at is what's the max out-of-pocket. In Beaufort County, there's an Advantage plan that only has a $3,450 max out-of-pocket. A lot of plans have an $8,550. Some have $7,500. Some have $6,000. It's a huge factor when you decide to pick what Medicare Advantage plan you're going to go with. But that is 2024. They are allowed to have as much as high as $8,550 out of pocket. That could be $10,000, $11,000 out of network for your max out of pocket. All right. One other thing is they cannot charge higher co-payments than original Medicare for certain situations. That includes chemo, dialysis, skilled care. They can charge you more than original Medicare for other services like home health care, durable medical equipment like CPAP machines or wheelchairs or things that you need for a special bed or things like that. Inpatient hospital services, they can charge more than original Medicare. That can happen if you go in and out of the hospital after a 60-day waiting period. So next thing we're going to talk about real quick is costs. All right. So again, we already said you still got to pay that $174.70 Part B premium. There may be a Advantage plan premium associated with the plan, but there are many plans that are zero premium. There are deductibles for things. Just a lot of plans have a $750, $500 medical deductible that's usually applied to things like MRIs, outpatient surgeries, hospital copays. Copays, you can have copays for everything. $300 to $500 a day copays for hospital for days 1 through 6, 1 through 5, 1 through 7, 1 through 8, who knows? They're all different. Coinsurance, you're going to have coinsurance. That coinsurance is going to be 20% for all radiation cancer treatments. It's going to be 20% for drugs like Skyrizi or Dupixent or drugs where you go to the doctor's office and they give you a shot that could be $20,000, $30,000. You got to pay 20% of that. And what's nice about Medicare Advantage plans, they do have a max out of pocket. So there's a, if you ever pay $8,550, if you pay all that up, you pay nothing for the rest of the year. The insurance company pays that for you. All right. So last thing is, if you decide to stick with original Medicare, you're probably going to get a supplement. All right. If you go with a Medicare Advantage plan, you're going to have a local network. Medicare supplements are nationwide. Getting down to the co-pays with Medicare Advantage plans, you're going to have a fixed copay for each doctor's visit. Plan G, there is no copay for doctor's visit with a supplement. Plan N, you got a $0 to $20 copay for doctor's visits, but after the $240 Medicare annual deductible with the Plan G and the Plan N, pretty much all your costs are paid for. Not pretty much, they all are. All right. With coinsurance, you do have coinsurance for Advantage plans. That is not correct. You have coinsurance for things like I said, cancer, outpatient surgery, durable medical goods. A lot of Medicare Advantage plans, be careful. They'll stick in 20% for outpatient surgery. You don't want that. You'd rather have a copay. I'd pay $300 a day, any day for outpatient surgery, over 20% of who knows what the final cost of the surgery is. Premiums, obviously, Advantage plans are zero or low. You're looking at $100, $130 for a Medicare supplement in Beaufort County, depending on your age. And prescription drugs, these plans include, Medicare Advantage plans include the prescription drug coverage. And with Medicare supplement, you would have to add a Part D standalone drug plan. Maximum out of pocket for Advantage plan could be as much as $8,550. With a supplement, typically my two favorite plans are the Plan G and the Plan N. Your max out of pocket is the $240 annual deductible for the Plan G. After that, you pay nothing for the rest of the year. The Plan N, you got the $240 deductible. Once you hit that, you do have a $0 to $20 doctor copay, $50 emergency room copay. And that's pretty much it. There's something called excess charges. I'm not going to go into that. 97% of all doctors accept Medicare assignment. Real easy to avoid excess charges, but that's for a different day. Tomorrow, guys, we're talking about enrollment periods, initial enrollment period, Medicare supplement open enrollment period, Medicare Advantage open enrollment period. We're going to talk about the special enrollment periods. That's for tomorrow. And then the following day, we're going to discuss Medicare Advantage versus Medicare supplement. What are the differences between the two, and what are the questions you want to ask yourself to determine which plan is good for you. You guys have a great day. This is Chris Dewey from May River Medicare, and have a good one.